Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hello, everybody. Hi, everybody on Instagram and YouTube. Welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence, the Older Adult Division. My name is Ellen Csepe, and I'm going to be here with you guys today hosting today's episode on post-polio syndrome and the basics. Now, I know what you guys are thinking. Post-polio syndrome? I really haven't thought about post-polio syndrome since I was studying for my boards. I totally get it. A lot of us don't treat post-polio very often, but today's podcast is going to be the basics for understanding post-polio and how to treat it as exercise professionals, PTs, OTs, exercise professionals. I want you guys to leave today understanding what it is, what the best research is substantiating, and the basics of how to treat it. So, polio is a viral infection that has basically been eradicated with vaccinations as of the 1950s, 1960s. It is actually a really cool part of our profession's history. And I don't know if many of you guys know this, but physical therapy, our profession, physical therapist profession, started in two different ways to treat people that had serious injuries. Number one, after World War I, we were basically Reconstruction aides. And then we also treated children that had post-polio after a major outbreak in 1916. So polio is actually really interesting because without polio, our profession might not be a thing. Without war, our profession might not be the same that it is now. So I have a significant passion for treating post-polio, but it's important to note now that it is a rare condition. Only about 20 million people worldwide are polio survivors, and not all of them have post-polio syndrome. So let's talk a little bit more about what post-polio syndrome is. Basically, 15 to 30 years after initial polio infection, it's a clinical cluster of fatigue, pain, muscle weakness, decreased endurance that's attributable to basically that change in muscle activation after initial polio infection. Polio infection can cause paralytic symptoms where people, or children most likely, are paralyzed. And after that regain of function, that post-polio syndrome occurs because basically those remaining nerves are basically dying off at a faster rate, and it's accelerated aging. So I'm sure not many of you have tons of patients with post-polio syndrome, and you might have only heard about post-polio syndrome on your board certifications. It is affecting about 15 to 80% of those people who have post-polio syndrome in this country. So about maybe 150,000 of them. Some of them are gone undiagnosed, and what it looks like, it can be very variable. Some people with post-polio just have muscle pain, fatigue, and weakness. Others have significant weakness and paralysis that requires the use of mobility devices like braces or wheelchairs. I have two patients on my caseload currently as an outpatient clinician that have post-polio syndrome, and I can guarantee that they're listening to this podcast at some point. And a lot of my passion for this topic is driven by them. So we talked about what post-polio syndrome is. It's a rare condition, a neuromuscular condition that affects a small percentage of the United States population. Let's talk a little bit about the current state of treatment in post-polio management. So unfortunately, post-polio, because it's so rare, doesn't get a lot of press. It doesn't get a lot of attention. It doesn't get a lot of funding. And the funding for us to understand research is pretty minimal. So unfortunately, understanding and treating post-polio is our job as clinicians, and People with post-polio know that they should be seeing a clinician who understands post-polio, but none of us really do. It's very rare, and it's hard for us to take care of those people very well because the research is so thin. And unfortunately, research and current medical theories for people with post-polio suggest that those people be exceptionally cautious with exercising. There's this idea that you can very easily overwork and over fatigue remaining muscles that aren't impacted by post-polio. So almost all of these people with post-polio are exceptionally cautious about exercise. Many of them don't. Many of them are very worried to exercise, and in fact, there are a lot of support groups that recommend that ADLs are enough to stay active for people with post-polio. Yes, a lot of support groups suggest not exercising at all or just doing very light or moderate aerobic exercise. But the research does not back up that recommendation. A lot of physicians and physical therapists come at managing these patients who have slow and gradual losses in their strength by suggesting that they're very cautious with any exercise and that they don't overdo it. So we know as fitness forward professionals that that language and that excessive caution could put people with post-polio at risk for not being active at all. And unfortunately, that's very true. So what do we do? How do we manage this? What does the research suggest? Current literature, like we said before, is unfortunately pretty slim pickings in regards to managing post-polio. We're going to be referencing a 2021 systematic review that looked at post-polio strength training and cardiovascular endurance. This was a pretty wide net for a systematic review. There were 21 studies in this Ramechadran et al. Systematic review that looked at people that had post-polio. 21 different studies did not give substantial effect sizes to suggest that they should or should not do cardiovascular or strength training exercise. So 21 studies, some of them from the 80s and 90s. And the effect sizes were rather small for all of them, but it did suggest that exercise, both cardiovascular and strength training exercises, are safe for people with post-polio, and that if there's a takeaway at all, though it is a small effect size, there was the strongest effect size for there to be benefits in management of pain and fatigue, some of the biggest and most life-ruining symptoms of post-polio. So the current literature, the current research suggests that exercise is safe. Strength training and cardiovascular exercise are safe. And while our research and the strength of that effect size is limited, we can say confidently that exercise is safe for patients with post-polio, and it can be helpful in managing pain and fatigue. So, the basics of managing post-polio. How do you do it safely? Because again, these are people who have heard for decades that they need to be careful. Don't overwork yourself. Don't push it. Be cautious. Don't do anything that's going to make you tired. Have low level or moderate level intensity for all of your exercise. These people are terrified. They're terrified that if they push their muscles, they're going to disintegrate. And these are a vulnerable and small group of patients that need our care. They need us. There's no cure for post-polio. There's no drug for post-polio. Rehabilitation professionals are where their hope lies. And it comes full circle because our profession started with polio survivors, children that had polio in hospitals. That's where our profession as PTs began. We can't give up on those people now. So the basics of managing post-polio and patients who want to get back to exercise. You can exercise. Exercise is safe for patients with post-polio and helpful in managing pain and fatigue. It's important to manage cardiovascular disease. It's important to prevent functional decline and manage our functional independence levels. Exercise is good, but there's a catch, there's a caveat. You have to be thoughtful because this is a very vulnerable patient population in regards to taking things too quickly. So, some considerations, basic things. You can exercise, but we want to be considerate in our exercise prescription to ensure that people are gradual with their progressions. Also consider that post-polio can affect muscles asymmetrically. So one of the two patients that I'm, again, certain is listening to this podcast, has less than 3 out of 5 strength on the left pec and 4 out of 5 on the right. So understanding that muscles that have less than 3 out of 5 strength should be intentionally cautious with strength training. But understanding that, knowing that he has an asymmetrical discrepancy in strength, I'm going to be considerate of that in my exercise prescription for his upper body. So just being considerate of those things, being intentionally gradual, and being cognizant of how traumatic this viral disease process has been for these people. Those things will set you far above the other clinicians that have worked with patients with post-polio. And I would really inspire you guys. I hope to inspire you to care about patients with post-polio. They're not a large group of the population, but we can make a big difference in their lives. The 2 patients that I have that have post-polio syndrome, one of them I hiked a 14,000 foot mountain with, and the other was in an unsafe mobility device, and I helped him access mobility devices that were safe so that he wouldn't fall out of a mobility scooter and had an adequate wheelchair. Both of those people, because I cared, because I put forth effort into understanding post-polio syndrome, their lives are better. And I know that with compassion and effort, you guys can help the patients on your caseload too. And I'm so thankful that I get to be on your team. I hope that people with post-polio know that our profession began with them, and we're certainly not going to give up on them now. So thank you guys very much for joining me on today's podcast episode, and I hope to see you again soon. Thanks.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.